good afternoon, good evening, and good morning, everyone. It's a pleasure for us in AeHIN to organize this webinar in partnership with the Health Intervention and Technology Assessment Program Foundation, HITAP team, and then have a very interesting set of speakers who have joined us, both from academics and then also from the government, and then also those like agencies which are actually supporting the national digital health programs. And then we also have WHO here. So it's a very interesting mix of speakers here and then also the participants. Before I hand over the floor to the moderator, I would like to quickly emphasize, like though everyone understands the importance of the digital health landscape assessment, how it is very relevant. Usually, this is the starting point or the essential first step when we begin, for example, a national digital health program, or to assess it or review it, or to have something new, for example, drafting a national digital health strategy or a blueprint or an enterprise architecture. So the essential first step is the landscape assessment to understand the stakeholders involved, the variety of stakeholders involved, and then also to assess the infrastructure, the workforce capacity, the regulatory frameworks existing, and then the gaps, and then also the various health interventions or digital health interventions in the countries, to name a few. So in this occasion, like why we actually do the National Digital Health Landscape Assessment, and then whom it actually benefits, how it is used. It's not essentially only an academic exercise, but then it leads to something more. Like, for example, like one of the things that later you will hear from the speakers is how we were able to work with a country where the national digital health assessment actually led to something more meaningful. So this is something that we would like to highlight in this webinar, where this exercise of landscape assessment leads to a tangible action, a tangible benefits to the country and then those who are involved. With those few words, I would like to hand over the floor to the moderator, Khansa Chavarina from HITAP. Khansa is a researcher on health systems. And then I would ask her to quickly introduce more about her and lead the session. Thank you. Over to you, Kansa.
Thanks, Jai. Hi, good morning, good afternoon, good evening, everyone. Really happy to be here. On behalf of HITAP, we really thank AeHIN for this opportunity, and we really look forward to the discussion of course presentations throughout this webinar. I would like to walk you through first to the session. We would like to first acknowledge, of course, our partners that has helped HITAP to support all of our activities. So the next is the session structure. So in the first 30 minutes, we're going to have presentations, very interesting presentations from Singapore, South Korea, and Thailand. And then we'll have 2 reactions from the AeHIN Working Council members, followed by open discussions, and then group photo. And then we're going to have special guests from the World Health Organization Thailand. Mr. Mark Landry here is here with us tonight, which will give her reflections and also his remarks. So without further ado, in the interest of time, I would like to introduce our first speaker from Singapore. I believe Dr. Jasper Tromp is here. He is the assistant professor at the NUS Zoey School of Public Health and the Duke NUS Medical School. He specializes in NCDs as well as digital health. So to Dr. Tromp, the floor is yours.
Thank you very much, Khansa. Thank you very much, AeHIN and HITAP, for allowing me to speak to you today. So I'm going to share a little bit more about the Singapore health system, and especially the digital health system that we have here today. And first, I also want to thank HITAP for the support in this project. So for those of you that are interested, whatever I'm talking about today is available in a report, which if you Google it, because unfortunately there's no link here, the public health landscape in Singapore, and otherwise I will make sure that there will be a link that can hopefully be shared by the organizing committee later. Now, Singapore has a mixed public-private model where 16 public hospitals handle most secondary and tertiary care, and then 80% of primary care is delivered by private GPs. The financing of the Singapore health system is done according to what we call the 3M model, with MediSave, which is a personal savings account, MediShield, which is a basic health insurance, and MediFund, which is essentially a backup safety net to help provide for citizens that are unable to cover their costs with the MediSave and the MediShield. Government subsidies cover up to 80% of inpatient bills. And generally, I would argue the Singapore health systems had relatively good governance and globally is known for its efficiency. Now, the national digital health strategy is captured by the Smart Nation strategy published in 2014, which was outlining a digital-first transformation across the government, economy, and society. Now, this Smart Nation strategy has 3 pillars: digital government, digital economy, and digital society. And for health, includes an emphasis on telehealth consultation, the introduction of Health Hub, which collects data on everybody's health status and connects this with the health system, and also things like the National Steps Challenge, which promotes citizens to move more. There's also the HIT map, or the Health IT Master Plan, which outlined the 3 beyonds: the beyond hospital, beyond quality, and beyond healthcare, which essentially highlights the need for digital transformation, not only within the health system, but beyond the health system, including digital literacy. Now, when we look at the regulatory framework for digital health in Singapore, it's regulated under the Health Products Act and the Medical Devices Regulation. It takes a risk-based approach and essentially regulates all digital health products that are considered to be a medical device. Now, this also follows the ASEAN Directive on Regulation for Digital Health, and that means that anything that is considered to be a medical device is involved in either the investigation, detection, diagnosis, monitoring, treatment, or management of a medical condition. So any digital health product that falls under that is considered to be a medical device. So that means that certain things are excluded, things like smartwatches or step counters, which are not involved in any of these and then therefore are not regulated. What's interesting in Singapore is that we had a digital health sandbox. I think Indonesia also has one currently undergoing. The LEAP sandbox that we used to pilot telemedicine was a collaboration between telemedicine providers and the Ministry of Health, where they looked at the individual risks that were associated with telemedicine. And the results of this sandbox, and this has now been closed, have been captured in the National Telemedicine Guidelines, which guide the requirements for service delivery. Now, when we look at AI in healthcare, this is covered by separate guidelines, the MOH AI guidelines, which also again covers AI that is within scope of the HSAs, the regulator in Singapore. So essentially AI that can be considered to be a medical device. Now, this is an example of the regulatory framework. This is a graph that we have from the report. Essentially, when we look at telehealth, if telehealth has the purpose of investigation, detection, diagnosis, monitoring, treatment, or management of the disease, it is considered to be a medical device. And then within that, there are 2 different distinctions made. If the device or software is intended for use only for general well-being purposes, then it's considered not a medical device. However, if it regulates or is involved in any patient that's being treated, essentially, then it's being considered by HSA to be a medical device, and it falls under the appropriate regulations. Now, when we look at digital health trends in 2022, the market size in Singapore was roughly about 431 million. There was a strong consumer demand overall. There's especially a strong growth in telemedicine, but also in the use of integrated medical records. Younger users prefer using telemedicine. Elderly still prefer in-person visitations. And there are important opportunities which are not rolled out at scale, I would say. including the use of AI in chronic diseases. So, for example, Singapore has introduced diabetic eye disease screening using AI. There's also been introduction of gamified health promotion with the National Step Challenge. There's an increase in the use of national electronic health records and the use of that data for research with the Trust platform that's been recently introduced that will probably be scaled over the next few years. Now, one thing to note is the need to improve digital literacy. So there's the Digital Readiness Blueprint, which covered access, literacy, and participation. There are a number of programs promoted by the governments under Skills Future, where citizens get essentially vouchers to improve their skills. There's the Digital for Life program and the National Digital Literacy program, which also leans heavily on local centers in the neighborhood where also elderly citizens can get support with their digital literacy needs. Generally, Singapore does pretty well in the digital inclusion ranking, but I think especially for the elderly population, there are still sort of opportunities to improve. Now, these are some of the important stakeholders in digital health that we identified in the report. Stakeholders include patient and consumers. There are academic and research institutions that do research in digital health, like NUS or A-STAR. We have MOH that sets national guidelines, the national regulator, HSA that regulates digital health. We have ACE, which is our HCA agency that does the HCA for digital health, essentially. Then we have funders, both public and private, both in terms of service delivery, but also, for example, in the research space. We have healthcare providers that are increasingly being involved in the design of digital health solutions, and pharmaceutical and medical device company and startups, where I feel Singapore has a really lively startup sphere and a lot of public-private collaborations between public hospitals and knowledge institutions on one hand, and on the other hand, companies that are working in the digital health space. This should read HCA. So the point about this is that the ACE or ACE conducts the HCA for medical technologies. Currently, it does not have a dedicated digital health intervention pathway. It does have what we call horizon scanning, where it actively goes out to scan for potential promising digital health interventions. For example, AI Echo, there was a report where they then evaluate potential evidence that might be there, including cost effectiveness, budget impact, and equity considerations. And that come up with, but based on that, they will come up with recommendations for reimbursement. There's currently reimbursement for telemedicine video consultations for 20 chronic conditions, which are covered under CHAS, which is a separate program for low-income households, as well as by MediSave. Now, this is my conclusion slide. I would say Singapore has slowly developed itself as a regional leader, arguably, in digital health, driven by the Smart Nation initiative. There's relatively strong governance, rapid adoption, especially during, but also after COVID-19. There is increasing availability of infrastructure, regulation, and innovation platforms. Now we have trust for sharing of digital health and data across different healthcare institutions. And Health Hub, which is a central hub where medical data is being collected, provides a solid foundation for all of this. There are still significant challenges, gaps in digital health literacy, arguably limited reimbursement pathways, and public trust concerns on data privacy. And I would add to this also a part of change management. I would argue that public institutions in Singapore are still relatively slow to change. So it takes quite a while for them to uptake new interventions, especially AI. I believe that with stronger financing mechanisms and inclusive policies, Singapore can further cement its role as a hub for digital health in the region, moving from innovation towards sustainable and equitable integration into healthcare. And with that, I'd like to thank you for your attention.
Thank you very much, Dr. Tromp. Okay, so moving on to our next presenter, we're going to have Dr. Jeonghoon, who is a full professor at the Ewha Women's University at Seoul, Korea, and also a adjunct fellow at the National Evidence-Based Healthcare Collaboration Agency, or NICA. He's an expert on health technology assessment and also health economics. He has spent long time in NECA and also served in various decision-making and advisory committees of public agencies, such as the Health Insurance Review and Assessment Services, and also the Center for Disease Control in Korea. Okay, Dr. An, the floor is yours.
Thank you very much for a kind introduction, and also I thank to HITAP and AeHIN for inviting me to speak in this prestigious seminar. Let me start with, in Korea, our national agenda on digital health. So every government for the last 2 decades focused on this is our future and try to enhance this industry. But later I'm going to talk about our challenges as well. So basically, this is a national agenda items, meaning that a lot of support, a lot of projects, especially a lot of pilot project has been done. And when I was in NECA, and after that, a lot of evaluation projects on their performance was also done. So for example, 2014, they tested this telehealth model in our military ground post, which is in the demilitarized zone. And then the coming out of demilitarized zone is not that easy, a lot of administrative steps. So that's why they introduced this telehealth project in that setting. And it was kind of, how can I say, unmet need type of the model. And also some people in the asylum, or especially elderly people in the facility, they do not have doctors on the facility. So telehealth was tried in some of the project, as well as some of the remote village and remote island does not have clinic or does not have pharmacy. Telehealth model was also used, combined with remote delivery of prescriptions. Next slide, please. And actually, this was almost more controversial to our professional society, trying to manage chronic disease better in the urban settings. They try to connect those chronic diseases like diabetes and hypertension with some kind of the remote consultations, but somehow that has more strongest resistance. But this model was also tried. In this model, look at more specifically, they linked through our cellular network. So they just attach it to each individual cellular phone with some kind of devices, NFC blood monitor or NFC insulin, no, NFC blood sugar level monitors. That type of devices collect data from individual patient home, and they set up the server to combine those data with their medical record and report to the medical doctor in the hospital. So some of our initial pilot projects clearly showed that those people combined with telehealth had a better management of diabetes. As you can see, they have the more lower blood sugar level maintained. Also, for the hypertension management, it showed a promising result, mainly for the systolic blood pressure part. So this was the biggest characteristic of Korean digital health environment. During the COVID-19 pandemic, actually, non-face-to-face healthcare, especially the telehealth models, were employed. But right after COVID-19 pandemic become not a problem, this was not how can I say, this was not maintained, and it just came back to before the COVID-19 period. So mHealth or telehealth, which was the basically had a strong resistance from our professional society, and they are criticizing by those 5 points. The community-based ones, they are afraid of competing with tertiary hospitals. So that they do not want to see telehealth in the neighborhood, especially in the urban area. And also they argue that it cannot be cost effective because it has a lot of devices attached to it. And then also they even argue that those countries try to impose telehealth is basically they have a shortage of the doctors try to complement. But as we have seen in the Singapore case, that is exactly counter to that kind of argument. Also, they express safety concerns, and especially responsibility was the big issue for them. Who will take responsibility? Those people at the end of the care, or those people in the remote area to give them some advice. So that kind of situation was one of the big characteristic. And also their kind of slogan is patient must see the doctor. And according to our medical services law, all the medical services should be done in the clinic or hospital. It cannot be outside. And also all the medical record cannot come out of those medical facilities unless it is allowed by law. So our NHI or our HERA, they collect the data set, but that's allowed by their own laws. So that's only for the telehealth part, but to fully introduce digital health, somehow we need this telehealth to be more used in Korea, but somehow that is one of the big obstacle. So some of the legislative actions which is needed to allow medical activities in some circumstances and some limited setting should be allowed outside of those clinics and hospitals. Then we can fully accept telehealth. But positive aspect is some of those devices like Apple Freestyle Libre to measure continuous glucose levels through those button type of the device. That was first reimbursed, but aftermath of the reimbursement was not the patient, but the healthy individuals use that kind of device to check for the blood sugar level spike or a lot of more diet-related activities. So that I think that was sold in large quantity in Korea, and all those collected data is going to their Abbott's main server out of Korea. Also, some of the 3D printing applications gained market approval, and that is also another big trend in Korea, combining the 3D printing application or the AI-assisted diagnosis. So the NECA is HTA agency, and they basically review those medical device or AI-related softwares. So some of the companies are very, how can I say, successful, and they become very big. Like those three companies are the leaders in Korea. And mainly AI-assisted diagnostic imaging is one of the big market. No, I shouldn't say market, big area of development, and many of those companies are developing AI-assisted software there, including some helping diagnosis, some basically helping the quantifying a lot of different information through the AI, and then also some of them even try to develop for the patient care, and also try to forecast some kind of medical emergencies, and they are basically more like a small venture type of companies are developing them. And some of the successful ones, they are now traded in public, and they become much bigger size. And currently, all these Korean developed AI or the devices are not covered by our national health insurance yet. So that is another issue all those companies are looking for. The digital health therapeutics is another area, so that about 10 of the products are on the phase 3 trials in Korea, and much earlier ones are those digital therapeutic apps for treating insomnia and respiratory rehabilitations, and some of the mental health related ones. NECA, state agency, is preparing for assessing those new type of the medical technologies. And this is one of the area they set up as a separate track for innovative health technologies. And they put value-based assessment to be slightly different from our traditional HTA on those medical devices or the apps. So once application is received from the sponsor of those technologies, it will go to our review committee on innovative medical technologies, and they will check whether that technology is eligible for this innovative health technology track. And once it is approved, they will go for the assessment, and they will make subcommittees, and the subcommittees the new one is upcoming is for Innovative Health Technology Assessment 1, and they will do this new type of HTL report, and then it goes to our traditional Committee for New Health Technology Assessment, and then they will decide whether they will check whether this new technology is eligible for the approval. And these are some of the new set of criteria they applied. So whether they are checking for this based on these criteria, 3 categories: technical property, social property, and medical properties. And one of the interesting things is they put the patient-centered technology. So some kind of more convenience to the patient is also considered. Not only the medical outcomes, but also that is one of the new criteria added. During the assessment, they will look at all these criteria: importance of the disease, rarity, also physical burden of the patient, quality of life, economic burden, and some kind of misuse in terms of abuse of the technology, and whether there is any alternative existing or not. So this is our traditional system of the healthcare technology assessment. NECA has this research division. They do the all age research regardless of the area, but their report is not binding with any decision making. But NECA also has one department called the New Health Technology Assessment, and that division's report is binding with the Committee for New Health Technology Assessment approval, and that's mainly for diagnostics and procedures. So drugs or medical devices, as a product itself, without any fee schedule, they will just get our regulatory approval and going to the HERA. And if HERA determine that's eligible for our national health insurance, then basically it is allowed. But any medical device required fee schedule, then it should go to the last track of the procedures. So the most of the AI or AI-assisted imaging, which needs a reading, that part we have a fee schedule. And medical digital therapeutics, if any professional require fee schedule to prescribe or monitoring the use, then it will also go to those less track of new health technology assessment. A standalone medical device, which can be just distributed, then it does not have to go through our new health technology assessment, like that freestyle libre. So in a summary, digital health is one of our area Korean government is pushing it for, but we have strong opposition on telehealth from the professional society. So that become one of the important obstacle to fully introduce digital health in Korea. So especially remote monitoring become one of the issue, unless there is unmet need. And AI-assisted software, 3D printing, those areas are basically well accepted by our physician society. So one positive side is there are many companies, even though size might be small, they are developing a lot of digital health products. So some of them gave up the Korean market and just directly going to the abroad. But many of the new technologies are developed inside Korea, and NECA is installing new track of assessment, innovative technology track, and that is one of the important to spreading out our digital health technologies in Korea. And I believe this is the last slide. Thank you very much for listening, and I'll be answering your questions later. Thanks again.
Thank you very much, Dr. An. Thanks for sharing. Really interesting to understand there's some kind of like a pushback from the professional society. Okay, so next we're going to hear a perspective from Thailand by Dr. Kingkaew, who is the head of the research unit at AeHIN-HITAP. She has extensive experience in conducting HTA, and particularly she's also member of the Health Economic Working Group under the Subcommittee for the Development of the National List of Essential Medicines. Dr. Kingkaew, please.
Thank you very much, Khansa, for your kind introduction. You can hear me well, right?
Yes.
Okay. Yes. And good morning, afternoon, evening, everyone, friends and colleagues. It's a pleasure to meet you all here today. Thank you, AeHIN and HITAP International Unit for connecting us to allow me to share the opportunity to share about the current state of Thailand's digital health landscape. So for the next 10 minutes, I will highlight the key components of the ecosystem, including strategic and legal framework, digital transformation in public health sector, health information exchange, and last but not least, the HTA for digital health technologies, and then wrap up with the challenges and future direction. So in Thailand, we have a national strategy for digital transformation aimed to create a digital-driven, innovation-led economy by improving digital infrastructure, developing skilled workforce, and fostering smart government. So basically, we put everything government procedures into digital platforms. So we have a legal framework for that. We established multiple acts to allow and promote the digital transformation in Thailand, including Digitality for Economy and Society Act, Electronics Transaction Act, and also we maintain the cyber security and protect people or data from cyber threats through Cyber Security Act and also Personal Data Protection Act or PDPA. And in Thailand, we also protect our consumer through two acts, which include the Consumer Protection Act and also Medical Device Act. So in terms of medical device, software as medical device, it will fall under the Medical Device Act. And in Thailand, we have ASEAN standard, and similar to Singaporean setting, we use the risk-based classification. But I would like to share you more about our flagship policy last year, which is the 30 baht treatment anywhere. So this policy aims to improve access to primary health care, and also the second objective is to have a digital transformation through the linkage between different application health information system across public health hospitals. So last year, the policy was done in 4 phases. So it was started in January 2024. We start with the pilot in 4 provinces because these are the provinces that have the same or similar health information system in the hospital. Next, in the second phase, it was expanded throughout the country, including 8 provinces. And for the third phase, including more provinces, and now we cover all the provinces in Thailand. So basically, the aim of this 30 baht treatment anywhere, we expand the healthcare providers, not just including only the private, not only including the public hospital, but we also expand to private hospital as well, including pharmacy, private clinics that are registered under the under the National Health Security Office. So what is different from this policy is that the Ministry of Public Health encourage hospital, the public hospital to submit or send the claims through what we call financial data hub. So FDH in the middle. So before the policy launch, the information was sent directly to the NHSO for the claim. But after the policy implementation, all the claims has to be submitted through the financial data hub run by the Ministry of Public Health. So right now, all 900 public hospital have now submitted the information through this platform. So why is it important that they have to send it to this platform? Because in the old days, the Ministry of Public Health may not have the full complete data set of claims data. Because this information was sent directly to the payers, right? And also the hospital has to key in multiple programs for different payers as well. So in Thailand, we have 3 main payers. So there's a lot of burdens towards healthcare provider in public hospital. So these financial data hub was aimed for reducing all this workload, and also have trying to set up information so that the Ministry of Public Health have complete data set. And they also trying to link the personal health records of the population through Prompt application. So basically you can download this application into your mobile phone, and they will have medical records and information like drug allergy into your phone. So the aim was to trying to improve people's accessibility to their own health record as well. So right now, the initiation last year, they expand to be able to link personal record with 10,000 providers. So these included the private and also public hospitals. However, there's not completely linked through the Ministry of Public Health, as you can see in the pink down below. So it divided into 13 districts. The pink highlighted here, meaning that these are the proportion of providers that is not linked through the Ministry of Public Health. So why, you may ask, because it will be linked, it was linked through another platform which is called HealthLink. So why is that? Because in Thailand, there are multiple public providers, the majority though under the Ministry of Public Health, but there are some health facility that is not under the Ministry of Public Health, and also under the Ministry of Higher Education or other private hospital as well. So the National Health Security Office trying to create the API to link all the important standard data sets so that the information can be used and also analyzed by the National Health Security Office, or NHSO here. Next slide, please. So when you see the landscape about the information architecture, how about the health technology assessment in Thailand? So in Thailand, we have the health technology assessment process to support the reimbursement list process. It includes medicines, vaccine, and also other types of health technologies. So AI, digital health technology, will be included in the Universal Coverage Benefit Package Design, or UCBP. So we have the 4 main process. So we have the nomination process, where general public or stakeholders can submit the request through the NHSO, and then the topic will be prioritized and then selected for HTA, either by full HTA or rapid assessment, depending on the requirements. And also after the HTA reports is complete, the result will be presented to the relevant working groups for decision-making process. So this is just the typical process that we have in Thailand. And in Thailand, we don't have the pathway specialty for digital technology yet. So right now in Thailand, we reimburse AI for chest X-ray reading as a part of benefit package. However, with the challenges of health technology assessment for digital health technologies, we found that with the rapid change of the technologies and also uncertainty about the cost and outcome in the future, therefore, and also there's sometimes it's involve user involvement that we require people to input their information into their digital platform. In Thailand, we did digital health literacy. So as you can see here, Gen Z, Gen Y, all those younger generation, they may not have problems as much as compared to the baby boomers. So when designed for the digital health technologies, the inclusiveness of these type of intervention, we need to consider digital literacy among the population as well. So the technology can be dispersed to, to be provided to all groups of population and less of the digital divide in the society. To sum up, digitization and interoperability of the health information in Thailand have opened various of opportunity for our health sector. There's still ongoing development, as you can see, because we have fragmented healthcare system. We're still trying to link and trying to exchange all the health information under different platforms in Thailand. And currently, there are efforts to trying to regulate digital health technologies, including the software as medical devices. And also, the government right now needs to keep up with the fast pacing of digital technologies development. So I would like to sum up that this is our future outlook. Just recently, on Monday, the Health Economic Working Group under the Universal Health Coverage Benefit Package Development, they would like us to trying to find feasibility of using the life cycle approach to health technology assessment in Thailand, especially in the AI enabled health technologies, because right now in Thailand we are doing more like cross-section health technology assessment. We do have early HTA, we do have the investment through I told you before, the UCBP and LEM and LEV processes. We also are trying to look at low value care so that we can disinvest some of the technology. However, these are just cross-section and it's not linked together. So next step for the next chapter in Thailand is we trying to see whether the life cycle approach would fit or be more feasible to do the HTA for AI and digital health in Thailand. Okay, thank you very much.
Thank you, Dr. Kingkaew. Very interesting presentation. Okay, maybe we'll move on to our next presenter. We'll hear a reaction from the AeHIN Working Council member. We'll hear from Dr. Zoey. She's a third-year PhD student in the Biomedical and Health Informatics program at the University of Washington, and she also have graduated from the Mongolian National University of Medical Sciences as a physician. Dr. Zoey, please.
So I'm very honored to be here today to share our country's journey with the digital health landscape assessment. We conducted it last year, and I thank AeHIN and HITAP for the opportunity to present our work. So in my talk, I will focus more on the digital health landscape assessment itself and more on its methodology, while Ms. Enkhtulga will focus more on the relevance of our assessment to the policy development after my presentation. So the digital health landscape assessment in Mongolia was very much a collaborative effort. It was made possible through very tight collaboration between UNICEF Mongolia, UNICEF East Asia Pacific Regional Office, as well as the Asia Health Mission and, of course, the government of Mongolia. So as the core assessment team, we defined the digital health landscape assessment as a strategic tool to guide the digital transformation in the country, in the health sector, and agreed that it really should help us decide what to invest in now, soon, or later. So we also needed to make sure it ensures that all stakeholders in the digital health ecosystem move forward together. So for Mongolia, the assessment was carried out in 3 layers. So at the national layer, we engaged the various ministries and their agencies. And at the coordination layer, we worked with the provincial health departments to see how national strategies were being implemented regionally. And at the operational layer, we looked at all 3 levels of hospitals. That includes primary, secondary, and tertiary, or specialty referral care providers that we call them, and as well as pharmacists to understand how the digital tools are being adopted in practice. So that being said, we really tried to provide a comprehensive view of our country's digital health ecosystem through this assessment. So in terms of methodology, our assessment used a structured and participatory methodology. First, we gather information through desk review as well as discussions with the government stakeholders. And second, we designed and adapted our assessment tool. Mostly we combined existing global frameworks. The 12 tools that we used in our assessment as base tools are listed on the slide, so you can see. So third, we defined the data collection methods. For Mongolia, it means that surveys and structured consultations, and also guided by stratified sampling to ensure all levels were represented. And finally, we conducted the assessment. We collected data at the strategy, coordination, and operational levels to produce balanced picture of the digital health ecosystem through interviews and Google Form surveys. But we conducted the Google Form surveys with live Zoom session guidance for our participants. And we were able to collect responses from almost 300 facilities across the country for the operational layer within a relatively short time frame. So in terms of the result, our results showed that our country, Mongolia, was, in terms of the digital health ecosystem, it's at a stage between developing and scaling up. And I have included some of the results as an example here. But of course, I only have 5 minutes and I don't have time to cover the full assessment result here. But I really wanted to highlight that our result included strengths and weaknesses at each 3 levels and provided recommendations for each of the 9 domains of the digital health enabling environment that we have assessed for this assessment. For example, it's governance and coordination, strategy and investment, or ICT infrastructure and human capacity, etc., to only name a few. There were a full 9 of the domains were assessed. So this is my last slide. I guess to conclude, the digital health landscape assessment has been really a powerful tool for our country, not only to understand where we are today or last year, but also to chart where we want to go. For those who would like to explore further, the full report you can access following the QR code here. And lastly, I want to thank you for your attention and also thank AeHIN and HITAP for the honor of sharing our work here. Thank you.
Thank you very much, Dr. Zoey. And so you can scan the QR code here for the full report, or I believe also has been shared through the chat, which same goes for Singapore Digital Landscape Report that has been also shared in the chat. Okay, so we're going to listen to our next reactions from the AeHIN Working Council member, from Ms. Ganbat. She's an expert for cross-sector coordination at the Ministry of Digital Development and Communications in Mongolia, and she has over 18 years of experience in information technology and also digital transformation in the field of healthcare as well as other fields. Ms. Ganbat, the time is yours.
Good evening, everyone. My name is Enkhtulga. I am currently serving at the Ministry of Digital Development, Innovations and Communications of Mongolia. It is an honor to be here today to share Mongolians' experience in mapping the digital health landscape and how it's guided the development of our national strategy. I would like to thank AeHIN and HITAP for this opportunity. The Digital Health Landscape Assessment, or DHLA, in Mongolia has been an important milestone for us. The timeline shows the process we undertook, starting with early consultations, moving through the assessment itself, and culminating in how the results directly informed our planning. Most importantly, DHLA wasn't just an analysis. It became the foundation that guided decision-making and eventually led to the approval of the National Master Plan for Digital Transformation of the Health Sector 2025 to 2028, which you can see here. This illustrates how DHL served not only as an analytical exercise, but a practical tool for shaping our strategic development. In Mongolia, developing a national policy or strategy is never done in isolation. Throughout the DHL and subsequent planning, we ensured active participation from all key stakeholders. These included government institutions, non-governmental organizations, development partners, private vendors, and software developers, as well as representatives from hospitals and end users. This inclusive approach helped ensure that the strategies reflect diverse perspectives and practical needs. The DHL findings were directly reflected in the National Master Plan for Digital Transformation of the Health Sector. For Objective 1, the DHL recommended the establishment of a digital health sandbox to encourage innovation. For Objective 2 and 3, it strongly encouraged the adoption of international standards. For Objective 8, the Digital Health Landscape Assessment highlighted critical gaps in human capacity for digital health, which we addressed in the plan. Finally, for Objective 9, based on the success of the AeHIN Convergence Workshop methodology in Mongolia in 2024, we planned a regular workshop. It set intervals to strengthen collaboration and partnerships. The DHL proved to be highly relevant in the digital health policy development of our country. It provided a clear picture of the current landscape, identified gaps, and recommended actionable steps for the future. It supported evidence-based decision-making, helped policymakers better understand the challenges and applied international methodologies in a local context. The assessment has thus been fundamental in ensuring that our strategy is robust, practical, and forward-looking. In conclusion, I would like to express my gratitude to AeHIN, UNICEF Mongolia, and UNICEF EAPRO for their support and partnership. The DHL has been a crucial foundation for Mongolians' digital health journey, and we look forward to further collaborations to strengthen our health systems in the age of AI. Thank you.
Thank you very much, Ms. Ganbat. So it's nice to hear how research or evidence has been used to inform policies, which is a very great example here. Okay, so we have about 10 minutes for open discussion. So I think we can take a few questions here. I can already see 2 questions from our colleague Ahmad Hidayat. So his question is, data flow to the national level depends on healthcare facilities' capability to transform the systems. What efforts have been made to empower these facilities to collect, process, and transmit data to the national level? So perhaps I would like to invite first Dr. Kingkaew, if you could respond to the question.
Thank you, Khansa. Thank you very much for the question as well. That's really important uh, uh, issue actually in Thailand, because in Thailand, even though we have digitized our patient data, inpatient data, but some of the like smaller healthcare providers, they may not have the health information system that may align with the requirements of the National Health Security Office. So in the past 1 year, there were problems about submitting the data. Some of the data set are not linked, therefore it affects the reimbursement of those hospitals as well. So what Thai government trying to do is to identify what are the health information systems that may cause the problem, and trying to have a team and go to each specific hospital to solve that issues. And also they right now we have the standard data set uh, to talk to communicate between each platform. So right now with the standard data set, there is less issue, but the more issue is more on the software itself, and also the training of the staffs, because sometimes these type of staff, there are how can I say, many rotations, so there need to be a lot of effort on training, and also trying to have the same data set that the central government provided to healthcare providers. So thank you.
Thank you very much. Dr. An, Dr. Tromp, would you like to respond to this question as well?
No.
Oh, I can maybe briefly respond at least. So there's been an effort underway in Singapore in integrating primary healthcare under Health Leader SG to essentially strengthen their electronic health record system, and then connect that with those from the national hospitals. I don't know the specifics of it, in the sense that I know that the government or MOH is providing some kind of a subsidy to do that and to roll this out. But I do understand that uptake has been relatively slow. I mean, I don't have anything more to say about it because I don't have any more information. But I think that's one of the key aspects here in Singapore, because we have largely private primary care providers that are in most cases single practices. So it's challenging for them to have the capital to invest in for example, a decent electronic health record system that communicates with upstream hospitals.
Thank you for sharing. And maybe Dr. Tromp, if could you please also take the second question from Ahmad Hidayat? He asked whether any countries, in this case Singapore, assess improvements in the healthcare facility capacity and capability after following the digital system transformation.
Ooh, that's a good question. I don't know. I think, I mean, at the secondary hospital level, clearly, but I think the digital health capability is excellent, I would argue, in hospitals in Singapore. Although I would argue that the uptake of new technologies is relatively slow, but that's usually more of a change management issue than it is actually anything else. Well, like I sort of mentioned, at the primary healthcare level, it's being assessed as part of Health ERSG, is my understanding, and uptake's been slow. But this also, I think, has to do with primary healthcare providers seeing the benefits themselves, I think. So it's not just the technology issue or finance issue, it's more of a people issue, and arguably I would say that's seems to be a common thing. So I think where we need to think about both the financing and the technology, it's also how to get people to come along with you in your vision, I think, what's key. Yeah.
Thank you. Dr. Kingkaew or Dr. An, do you have any responses to this question?
Yeah, so in Thailand, the Ministry of Public Health, they set this indicator we call Smart Hospital. So basically, they have a list of standards on the requirements, how to transform, and they will give the grade to these hospitals. So they encourage them to improve their infrastructure, and also the Ministry of Public Health, they have what we call digital literacy for health professionals. So there will be online courses that they can enroll and can get the credits from these online courses as well. So yeah, those are indicators set by the Ministry of Public Health, and they have tools to support public health providers. Yeah, thank you.
Thank you. Dr. An, do you have any
No,
responses?
as I'm aware of, there's none in Korea.
Okay. So maybe I'll take just one question because I have this burning question to all speakers, perhaps starting to Dr. An and followed by Dr. Kingkaew and then Dr. Tromp. So are there any roles for regional or global collaboration in the adoption of digital health technologies, whether it's in the role of the health technology assessment itself or in the digital transformation? So yeah, maybe you can reflect from your experiences.
No, traditionally, HT link kind of exchanged a lot of information together, and especially assessment report. And digital health is also one area we can definitely exchange our experiences, and that will basically help each other. So, I mean, I can see a lot of collaborations in terms of assessment, but other than that, I am not sure what kind of collaborations we can do.
Thank you. Maybe Dr. Kingkaew?
So I think what we have here is the regulatory process for software as medical devices that we use the same standards, ASEAN standards. So basically, the approval process to enter the market will be shorter for digital technologies that already have an approved elsewhere. So basically, this dossier, they will have a specific set of dossier, and for those that already get approval, it will be quicker into Thai healthcare market. However, with the health technology assessment, as we all know, there's still challenges towards the assessment process for this fast-paced technology. So I think in HT Link, we are trying to come together and form the value framework for digital health technology as an AI in the future. Thank you.
Thank you. Dr. Trump?
Yeah, well, I think a lot's been said. I think in HCA, there's especially an opportunity for collaboration. I would argue in AI for regulation, there's an opportunity. So there's currently the digital health regulation sort of director from ASEAN. It doesn't extend to AI. So one of the challenges is that you see with medical imaging, for which AI is used, shows differences in ethnicity. So for example, Asian breast cancer breast tissue is denser than the breast tissue of, for example, Western populations. And that means that if you have an AI device that is approved for this by a regulatory agency in Europe, like let's say the EMA or the FDA, it might not work in that same way in Asia. And I think now what we see is that for many countries, including for Singapore, they have reference regulatory agencies, which are usually in Switzerland or in the EU or in the US. I think a lot of things can go wrong if we sort of take their judgment for AI devices, especially for imaging data, at face value. And arguably, I would say that there's a value to create for having reference regulatory agencies regionally, especially for AI and imaging type of interventions. Thank you.
Thank you. Thank you. I can see there's actually one question in the chat, but unfortunately, due to the interest of time, I think we can take the question separately with the speakers. So maybe to summarize from the amazing presentations is also the discussion, the first point that I noted is that landscape analysis can be very helpful to improve understanding and charting a way forward. And of course, there are different methods available. One of them is one that has been presented. And also we see political commitments and investments is also critical in providing directions, resources, and also the legal framework. And also there's we need to also understand how the demand about digital literacy, the acceptance from the professional societies, the patients, and also reimbursement pathway for digital health varies by countries, and also role of the health technology assessment has been highlighted by the 3 countries in the context of a rapidly changing technology, although there are a lot of room for improvement. So I would like to thank all the speakers for this session, and perhaps I would like to invite Jai for a quick group photo before we hear the closing, the reflections as well as closing remarks from Mark Landry. Please.
Thank you, Khansa. I think it has been a very interesting share, and then also a good variety, I would say. But I think we will also take this opportunity that we would like to, AeHIN would like to thank Foundation Pierre Fabre, who has been supporting AeHIN. In fact, like with their funding, it was made possible to strengthen the AeHIN's communities of practice, and this webinar is part of the series that has been supported by the foundation. I think maybe we can take a quick group pick and then over to the closing remarks from Mark. Thank you.
Thank you, Kristen. Perhaps I would like to invite Mark Landry to give his reflections and also closing remarks, please.
Thank you so much. I really appreciate the chance to just kind of summarize some of the things that we learned from our colleagues and for this rich discussion and insights. I think what I take away from today about assessing the value of digital health in the age of AI, it really requires us to expand our lens. I mean, from the work and the assessments from Singapore and South Korea, Thailand, Mongolia, you know, they each showed us a different piece of the puzzle around the smart nation stuff, the smart hospitals platforms in Thailand, you know, the rigor of the HTA processes, you know, using UHC, linked digital reforms for leapfrogging, telemedicine, telehealth, and remote areas, et cetera. So, you know, these examples, they remind us that value can't be measured just on cost effectiveness alone, but, you know, we have to be careful and inclusive and build trust and aim towards greater resilience. And so, you know, I think the real question is whether, you know, is the digital health or these health technologies, are they truly embedded into the fabric of our health systems? You know, in Thailand, for example, integrating digital into the UH financing scheme and the 30 baht scheme is a good example. You know, unless digital health and AI are part of these national benefit packages and part of the reimbursement structures, they risk remaining, you know, parallel and as pilots, not really helping, excuse me, with health systems resilience. You know, but embedding digital health also means rethinking the governance. We didn't hear too much about that, but I think we saw, particularly from Singapore, you know, the importance of very strong, and Thailand, I mean, you know, the very strong legal frameworks. But, you know, they often are fragmented and lag behind innovation itself. So in an age of AI, stewardship must evolve. We have to move from siloed regulations to ecosystem-wide. Think about the ethics, financing, data use, innovation, et cetera. Certainly, I think, you know, WHO, you know, we have some of the bits to help with guidance and norm standards, all of that. But, you know, what I also heard today was that no single country has the full answer. You know, we heard many different unique strengths. Like I said, the regulatory rigor, the HTA discipline, UHC integration, inclusivity. But imagine, you know, bringing the power of these different learnings together, and I think that's where AeHIN provides exceptional capacity to, you know, think about regional mechanisms for shared assessments, harmonized standards, co-creation, et cetera. So I think finally, and it comes back to Dr. Tromp, what you said, we have to remember, keep people at the center. And, it's never about the technology, whether it's, physicians and their concerns in Korea or, some of the rural poor patients in Thailand or communities in Mongolia. Digital health will succeed only if we co-create with their priorities and their benefits in mind. So perhaps the provocation that I want to leave everyone with is, are we ready to redefine the value, embedding digital health into resilient systems, govern it in the era of AI, collaborate across borders, but I think above all, keep people at the heart. So I think let's remember, this isn't just about stock taking, but it's about evidence-based decision support, and we saw that very clearly from the examples. I really appreciated how well this assessment and work was used to really inform change, and I think that should be part of a regional movement in this area. So thanks for the chance to just share some reflections, and well done. I appreciate the intensive support from the moderator as well. So thank you again.
Thank you very much, Mark. So maybe now I'll hand over the session to AeHIN, and I would like to thank all the speakers again, the participants who have spent their time tonight with all of us learning about digital health landscapes. So yeah, thank you.
Thank you, Ms. Khansa, to HITAP, our partner for this webinar, and to all our speakers and reactors. So before we end, we'd just like to invite you to our upcoming webinar on September 25 at 11 a.m. UTC +8. So our topic will be building national e-claims ecosystems. So you may scan the QR code to register. Thank you, everyone, and have a great night. Bye.